First off, I want to thank everybody for taking the time to listen on my behalf. I know there's a lot going on and we don't have much time. Again, my name is Alejandro Deca Martinez, and this is my introduction in support of additional farmers markets in Kalihi, Oahu. This is the abstract that I'm sure some of you have already seen. Basically what it's saying that there's an epidemic of obesity and malnutrition across the globe. It affects the US, the state of Hawaii, and Oahu, and more importantly, Kalihi. Now Kalihi is an area of where people have grown up and work like any other person in the US, but it's ironic because they serve places like Ala Moana and Waikiki where they have luxurious foods, healthy foods, and yet in Kalihi there are people who are not getting the necessary foods for themselves. They can't afford it, it's hard to get, they don't have the time. We go on and find different reasons. With that, this is considered a food desert because residents lack access to healthy food and must therefore depend on fast food stores that sell inexpensive high-calorie products. Basically, it's an area where there are high obesity rates, and if we are to locate additional farmers markets within walking distance of Kalihi residents, this will not only improve their physical well-being, but also build a sense of community identity, cohesion, and pride. The entire solution will be deemed a success when we see an increase of fruits and vegetable consumption within the first 6 months. That will indicate residents have embraced the farmers markets program. This is the initial investigation on 4 determinants and their factors. So geography. People living in food deserts have limited access to healthy foods. Living in a specific area is going to play a part on how you eat. Exposures of unhealthy foods at high rate towards children and how some unhealthy foods have escalated to begin an influence within the food desert on Oahu. Basically saying if your child is obese, you're looking at potential health issues compared to other kids. Number 3, number of farmers markets and how they impact communities, especially communities that are considered food deserts. We're going to talk about it. And the effects of obesity in the communities of Hawaii and Oahu. We're looking at a lot of issues ahead of us. There's nothing good with obesity in the community. You can go listen to other presentations. I'm sure you're going to see a connection of negatives from them to this statement. I want you to take a look at the Kukua Valley and see how they have a farmers market in the map. You notice there's a river. I'm just saying, putting another farmers market across the river for the people, hint hint. Alright, so there are 2 solutions that I like, and I know many people would also like. However, you can see there's a clear difference when it comes to stakeholders, politics, and money. The first one is construction of farmers markets closer to low-income areas. The number of farmers markets have already gone on a rise nationwide due to the amount of people that like to attend them. So this is a trend that can be considered to invest more in. The second one is more healthy food in convenience stores. 90% of the food consumed by people in the state is imported. Imagine the liquor stores and convenience stores selling local food. Also, local businesses wouldn't lose business because the new product will come out of the stores. I believe the first solution is an easier solution to address the obesity and malnutrition rate in Kalihi because the cost is not as much as solution 2. It also is the most interactive one to the public. The community comes together at a specific place for the food that is sold by other community members. So what is this solution going to look like? Everyone is going to be invited to this. Before the pandemic, I went to a thing called Eat the Streets. It was massive, with hundreds of people coming to eat. We're going to go that big. But clearly the priority will be people who are considered obese, at risk of obese, or the people who are belonging to the lower socioeconomic status. Do they fall under the federal poverty line? Do they not have a car? Are they struggling with bills to the point that food is just another term to them? Are they a single mother who takes care of their children and is forced to feed them junk food because that's what's going to fill them up? These are the people who we want to show up. How big this can be will be determined by the amount of people showing up. In other words, supply and demand. So we have to ensure the community knows about this and are invited. We have to know our sellers and what they are selling. And then we have to assemble a market that is easy for everyone to walk through. Look at the staff. There will be a director, a treasurer, a promotion director, research officer, and volunteers, the backbone of it all. We can get them from schools, universities, or people who just want to simply help. So in the order of a specific farmer's market, we have to select a destination, ensure where customers know where to purchase specific items, maize, pumpkins, cucumbers, tomatoes, ensure the food is affordable, and then obviously inspect the food. There will be no mishaps because the process of this will be one step at a time for full accountability. Ask me where the money is coming from. any stakeholder who is interested. This falls under public and private, and there will be grants, federal and state. In other words, this ain't going to cost a dime. Your car payment will hurt you more than this. The evaluation of this project to be a bomb or bust. Who is the evaluator? I'm the evaluator. You're the evaluator. I'm not a businessman, and I don't know who is in the audience is, but we have to have that kind of mindset. The amount of people purchasing food, the amount of vendors, and their diverse selection of foods will be factors. In other words, supply and demand. The fast food companies know how to evaluate. We have to beat them at their own game. Also, Google the term green business. You see the picture of the stages of change behavior? That is the public health stages of change behavior. So what we want is a decrease of obesity rates and change behavior where people are embracing healthy eating habits. Finally, building a sense of pride. Look at Detroit, they have Motown. Look at Portland, they're known for being the greenest US city. Look at Denver, known for gyms. This is a project that can escalate where there is pride in Kalihi that can be known as the new healthy spot, a sense of identity. It's 2021, and the past year has been rough for so many people due to COVID-19 and other social issues. There's a lot of work to be done to ensure equity and the decrease of many stresses that people go through. Imagine not having the stress of electric bills, debts, or in this case, not worrying about unhealthy food. I want to thank Erlindira Aldana for ensuring standards on me and Linda Ellingson. Enough said.